A rare and deadly virus is now triggering international concern after multiple hantavirus cases were linked to a cruise ship outbreak spanning several countries. Health agencies across Europe, Africa, and North America are racing to trace passengers, monitor exposures, and contain the spread of what experts describe as a highly unusual multi country hantavirus event. So, what exactly is happening? The outbreak is linked to the Dutch expedition cruise ship MV Hondius, which traveled through parts of South America and the South Atlantic before several passengers began developing severe respiratory illness. According to the World Health Organization, multiple confirmed and suspected hantavirus cases have now been identified, including several deaths. Authorities say the outbreak involves the Andes strain of hantavirus, a particularly concerning variant because it is one of the very few hantaviruses known to occasionally spread from person to person. That detail has significantly increased global attention. Unlike most hantaviruses, which spread mainly through exposure to infected rodent urine, saliva, or droppings, the Andes virus has shown limited human to human transmission in previous outbreaks. However, health officials continue to emphasize that the overall public risk remains low at this stage. The World Health Organization, the CDC, the European Centre for Disease Prevention and Control, and multiple national governments are now coordinating investigations and contact tracing efforts. Passengers from multiple countries were reportedly on board the ship, including travelers connected to the United Kingdom, the Netherlands, Germany, Switzerland, South Africa, and the United States. The situation became even more alarming after suspected cases emerged outside the ship itself. Reports indicate that possible linked infections are now being monitored in remote territories and several countries following passenger movement after disembarkation. One suspected case was identified on the isolated island of Tristan da Cunha after exposure linked to the ship's earlier route. Meanwhile, US authorities have begun arranging monitored repatriation flights for exposed American passengers. The CDC has classified the response as a level 3 emergency activation, not because the virus is spreading widely among the public, but because the outbreak involves multiple countries and requires coordinated international response. Now, many people are asking the same question: could this become another pandemic? At the moment, experts say that is unlikely. WHO officials have publicly stated that this is not expected to become another COVID style pandemic. Here, most hantavirus infections still occur through rodent exposure rather than widespread human transmission. However, hantavirus remains extremely dangerous because of how severe the disease can become. The virus often begins with symptoms that resemble flu, including fever, fatigue, muscle aches, headache, nausea, and dizziness. But in severe cases, patients can rapidly develop respiratory failure as fluid accumulates in the lungs. Some forms of hantavirus pulmonary syndrome have fatality rates approaching 40% or even higher in certain outbreaks. Another challenge is that there is currently no widely approved specific antiviral cure. Treatment mainly focuses on supportive hospital care, oxygen therapy, and intensive monitoring. Investigators are still trying to determine exactly how exposure occurred on board the ship. Some reports suggest passengers may have been exposed before boarding during excursions in South America, while others are examining whether limited person to person spread may have occurred afterward. For now, public health officials continue stressing prevention and awareness. The CDC and WHO advise avoiding direct contact with rodents and their waste, especially in enclosed spaces like cabins, storage rooms, barns, or abandoned buildings. Cleaning contaminated areas using disinfectants rather than dry sweeping is considered especially important because sweeping can aerosolize viral particles into the air. What makes this outbreak historically significant is not only the virus itself but the international nature of the event. A disease traditionally associated with isolated environmental exposure is now being tracked across multiple countries through international travel routes, cruise tourism, and global mobility. And while health officials insist the broader public risk remains low, the outbreak serves as another reminder of how quickly infectious diseases can cross borders in an interconnected world. For now, monitoring continues, passengers remain under observation, and global health agencies are working to prevent further spread. Because even though hantavirus is rare when it appears, the consequences can be deadly.
Subscribe to MedPharma Global and follow us on LinkedIn. Join our network for the latest in pharmaceutical innovation. Subscribe and follow us today.